talking about an important topic that most of the people feel like it's neglected, and maybe it's because there's no that much awareness about it. And today we have a guest here with us. She'll be talking more about mental health. Welcome.
My name is Emily Okoth. I'm a clinical psychologist and also a career manager at KCA University. Thank you.
Okay, thank you. So, like I said before, most people feel like mental health is the most neglected area of health. So maybe it's because there's not that much awareness in it, and people suffer from it most of the time, but still they don't have that much knowledge about it. So can you please tell our audience what's the difference between mental health and mental disorder or illness?
Okay. Thank you. Mental health generally, it has to do with the feeling when someone feels that they're not okay. When you're feeling you're not okay, it could be because of anxiety, it could be because of stress, it could be you're depressed. So when you have anything that causes anxiety, you could be said not to be mentally stable. Mental disorders, on the other hand, has to do with psychopathology. The disorders mostly are because of personality, for example, most of the time. For example, you can have someone who has bipolar or someone who has anxiety disorder. So those are disorders, they affect the way someone functions. But you know, for mental well-being, sometimes it's something that is not there permanently. But when it is a disorder, then it means it has happened for a long time, maybe for 1 month or more. So for it to be said to be a disorder, it must have taken place for a time. For example, if you say bipolar, that someone is bipolar, it means they have frequency of anxiety, stress, and it has happened for more than 1 month.
Okay, so how many cases do you attend to in a day?
It depends. At the moment, students are having exams, so we are having like 2-3 students in a day. But there are times we do even up to 6 because we have 3 counselors. So sometimes it's even more than 6. So, and the maximum one can do in a day is 5, and the minimum can be anything 1 or 2. But the maximum should be 5 because for the mental well-being of the counselor also they have to be okay.
Okay. So what factors does contribute to mental illness among the university students?
Okay. At the moment, the most rampant is drugs and substance abuse. Many students are taking drugs and it's really affecting them. It's affecting their mental status because most of the time when you take drugs, then you cannot think straight. You know, your thinking capacity is kind of altered.
So,
Yeah.
Okay.
Mm-hmm.
So do you think improving mental health literacy is an important aspect in university students?
Yes, we're actually doing it. That's why we have a counseling unit. Okay, we've done a survey before just to find out the mental health status of our students at KCA, and we found out that many of them have anxiety disorder, many of them are depressed, many of them are having issues to do with relationships. So apart from drug and substance abuse, there's relationship issues, there are also parental issues, there are also issues to do with sexuality. Some of them are LGBT. So there are many reasons that people get into depression or they're not mentally well because of the issues they pass through.
Okay. Thank you. That's all. Thank you for your time.
You're welcome.
Okay, that's all.
Thank you.